Next, this Saturday marks 1 year since President Trump signed the One Big Beautiful Bill Act into law, and a year in, its healthcare provisions are already starting to take effect. The Congressional Budget Office estimates the law's Medicaid cuts top $1 trillion over 10 years, and by 2034 leave about 10 million more people uninsured. That said, the law does put $50 billion into a rural health fund to help offset some of that, though KFF notes it's a fraction of the estimated $137 billion in rural Medicaid cuts. For physicians, the law gave a one-time 2.5% Medicare bump for 2026, but that expires at the end of the year, and the AMA says other adjustments in the fee schedule already eat most of it. So unless Congress acts, build your 2027 budget, assuming that raise is already gone. The other big pressure point is coverage. New federal data out last Friday shows ACA marketplace enrollment fell about 13%, roughly 3 million people, after enhanced subsidies expired at the end of last year. The administration credits its fraud prevention efforts for a significant portion of that drop, whereas KFF ties it to the premium spikes that expired subsidies caused. And with Medicaid work requirements and more frequent eligibility checks phasing in over the next year, practices should expect more coverage churn, patients cycling on and off insurance, and a tighter payer mix. So we want to hear from you in the comments. On the ground, how are you planning for the payment cliff and the coverage churn heading into 2027?